All right, good. So we shall get started. It's 8:06. Again, by way of introduction, my name is Dr. Frank Minja. I'm from Tanzania, based here in Atlanta, Georgia, at Emory School of Medicine. It's my distinct pleasure to introduce my good friend, Dr. James Ignas, who will be leading us on this session called USMLE 101. And this is really an introductory session for people who don't know anything about USMLE. Hopefully you know what USMLE stands for, which is the United States Medical Licensing Examination. And this is the process that you need to go through if you would like to get your postgraduate training in the United States. And again, by way of overview, we have three such sessions. This is the first one that we're doing today in November. We'll have another one, I believe, in February, which is going to be 201. And I think James will kind of give you steps for how to join that group. And then in May, we will do USMLE 301. And usually, if you go through these three steps, it should put you in a reasonable competitive position to apply for your training in the United States, should you wish to do that. So again, without further ado, I'm going to turn it over to my good friend, Dr. James Ignas to lead the first part of the session. And then we'll have our colleagues who are also going to share their sort of insights, and then we'll have a Q&A towards the end of the session. In the meantime, if you have a question, drop it in the chat. We can answer some as we're going. And go ahead, Dr. James. Karib.
Hello, everybody. Welcome to USMLE 101 2024 version. My name is James Ignas Kola. My patients calls me Kula, so sometimes I refer to myself as Dr. Kula. Born and raised in Tanzania, did my medical school in Muhimbili, and then after my internship, went to Kenya, where I worked for 2.5 years. Started to try to pursue MRCP, didn't work up well. That is a story for another day. And so I applied for MPH and came to the Johns Hopkins Bloomberg School of Public Health for my MPH degree. So I finished my MPH, started working in HIV drug and vaccine clinical trials.
Dr. Ignas, when you're doing the intro remarks, you want to just switch off your slides so that way you can appear better on the thing? Whatever you want to do, just a second.
I think it's fine. Let's go. Let's go for it.
Awesome.
So I did I was doing research, traveling a lot, loving it, but I miss clinicals. And I made a decision, like I want to do my exams and I want to go into residence. So once I made that decision, I flipped my switch, put my head down, and in 18 months, I was done with my USMLEs and I was applying for residency. So I'm double board certified in internal medicine and preventive medicine, and did my residency here in Griffin Hospital, Derby, Connecticut. Graduated, started working as a hospitalist in a private hospital, kind of community hospital, then came back to Griffin, and I'm now the associate program director for the internal medicine, preventive medicine residence program. So I treat patients, I recruit and teach residents. So I know, all what you're going through as you're trying to apply, because it's something I've done and I continue to do as I keep training the next generation of physicians. So as Dr. Minja has said, you can put your questions in the chat box as we go, and so that you don't forget. I have an elite group of panelists who will be kind of responding to your questions, people who are at different stages of their training. And of course, they will be answering, and those key repeating questions will kind of go through them live and give you further insights. So this is the second year we are doing this. We started last year, and I'll provide progress of what is happening. But really trying to do this, our aim is to try to reach the unreachable. Before it was people who know me or know Professor Minja, or know somebody who knows me, or know somebody who knows somebody. But by harnessing on the technology and trying to go through Zoom, we are trying to reach the people we don't know, trying to identify some potential people who can take this information, run with it, and be able to kind of pursue the residence program. So the topic is real wide, and but I'll try to start from the basics and kind of explain in a nutshell how things goes and give you the basic information what you need. And this is one of the 3 talks that we give. We have a 201 whereby we talk about how you study for the exams. It's a completely different way you do. And then the 301 where we talk about when you're applying, like how do you position yourself to succeed. So my panelists that I'm bringing in, I have across the training spectrum, starting, and I will present them in that hierarchy, starting from people who are applying to those who are seasoned attendees. Apart from Professor Minja, who has introduced himself, I have with me today Eligape Urasa. Is originally from Tanzania, born and raised in Arusha. So I say he's a sugar boy from Arusha. He trained in KCMC, did his MD in KCMC. Currently, Eligape is practicing in India and is interviewing for PGY1 slots in July. Good luck, Eligape, in your pursuit of residence. We are here to support you, and hopefully it turns out for the best. So with me as well, I have Roland Semakula. Born and raised in Uganda, a product of Makerere University. So Roland went to Makerere, is now a PGY1 pediatrics at Driscoll Children's Hospital in Corpus Christi in the great state of Texas. So thank you, Roland, for volunteering to be in our panel to support our colleague from the Peel of Africa from Uganda. So Uganda, feel you are presented, and you have somebody on the panel. And then we have Moza Abed Hamoud. She's currently PGY1 internal medicine in Ezehua internal medicine residence program in California. So Moza volunteered in all our 3 sessions last year. She was a MD4, like finalist, because she trained in St. George University in the Caribbean. They do 4 years, like in the United States. And so she was applying just the way Eligape is applying. It's 5 a.m. in California, she worked up to be here. I appreciate you coming on to help us, and thank you very much. And you are presenting Mombasa, Kenya. So welcome aboard, Moza. I have with me also Mangaro Mabusi, who is currently a PGY2 at Woodhull Hospital in Brooklyn, New York. And also he volunteered last year as PGY1. He's originally from Tanzania, Mabusi, but he trained in Cuba. So he did his MD in Cuba. Actually, Mabusi did his step 1 in Jamaica while he was in Cuba. And then he worked briefly, did his internship in Muhimbili, worked briefly in Aga Khan, before coming to the US to start his residence. And the way I knew Mabusi is very interesting. Apparently, his grandfather went to school, was a classmate of my neuroanatomy professor, Professor Mtui. And so I think he spoke to his grandfather, like, I want to pursue residence. I want to go to the US to train. And so his grandfather is like, I know my colleague, my classmate who is a professor. And so when he approached Professor Mtui called me like, I have this young man in Cuba, MD4, he wants to do residence. Can you please help him? I said, sure, give him my number, let's talk. And so we started talking from there and kind of strategizing. Mabusi is an aspiring critical care and pulmonary kind of a guy. He wants to do that fellowship and probably move into interventional pulmonologist. So the other one picture is taking his coffee, strolling in to see his patients. And the other one is attending the American College of Chest Physician meeting in Boston. So he's an aspiring pulmonologist, and that is his college professional home when he kind of completes. So we have also with us Otioli Wambalaba from Jamhuri ya Watu wa Kenya, product of University of Nairobi. He's currently PGY2 in Griffin Hospital, where I work. In my resident doing categorical internal medicine. Thank you very much, Oti, for presenting Jamhuri. We have Hezbon Magacha. He's born and raised in Tanzania, went to Tabora High School in the central Tanzania, did MDO in Cuba, like Mabusi, and then is currently PGY2 in internal medicine at East Tennessee State University in Tennessee. He wants to pursue gastroenterology and probably transfer, interventional gastroenterology skills to Tanzania. So welcome, Hesbon. I was expecting to have Pilka Menj with me. I didn't remove the slide. She couldn't make it. There was a last minute schedule change. And so she's originally from Tanzania, but grew up in Kenya. Graduated from Muhimbili, came to the US to do MPH at Boston, and then did her exams, and she's doing internal medicine at St. Vincent Hospital in Massachusetts. So she's PGY3. She's now applying for jobs and kind of looking to transition July 1st to be an attending. With me also, there is Barbara Odak, originally from Kenya, born and raised, from Kenyatta University. Jomo Kenyatta is represented in the house. Barbara did her MPH at Yale, and it was when she was at Yale that she met our residents who are doing MPH in their third year because of the IMPM. Introduced her to us. We interviewed her. We saw a solid candidate, and she's here with us. She's PGY3 now. She's aspiring to be a cardiologist, and so I think in the summer, she worked at NIH doing some cardiology research. The picture you see is me and Barbara in the American College of Physicians Connecticut chapter in October. So she had a poster she was presenting, and I sneaked by, took a picture, and trying to mentor and make people shine. We have from Republic of Uganda as well, Amiri Mbonde. The name sounds Tanzanian because his great-grandfather was from Tanzania, from Rufiji. So Ambiri Mbonde is a neurologist. He was born and raised in Uganda, is Ugandan. He did his medical school in Mbarara, did M.Med in internal medicine in Mbarara as well. And then when he was doing his M.Med, he met a professor from Mayo Clinic in Arizona who went to do kind of work at Mbarara, a neurologist. And they don't have neurology as residents or M.Med in Uganda. And he really liked neurology. And so he kind of started building relationships, working for his exams. He came, did his residency in neurology in Arizona. Then he went to do stroke at Harvard, Massachusetts General Hospital in Boston, and then went back to Arizona to do epilepsy, EEGs. So he has 2 fellowships in stroke and EEGs, and is now going to start as a neurology attending in Augusta, Georgia. So he's transitioning to Augusta to take his attending job and continue to move. And this is a paper which Amiri published, providing neurocritical care in resource-limited settings. And these really are the things which you can do when you are highly trained and you have the skills that you can acquire, whereby you can transfer your skills home and kind of build the capacity to help to be able to have, high kind of caliber medical services. I have with me my colleague, Israel Kasago, graduate of KCMC, born in Dar, grew up in Arusha. He calls Arusha home. He did his pathology residency in Albany, New York, and then did a triple fellowship. First in molecular oncology in Tampa, and then molecular genetics in Sloan Kettering Memorial Sloan Kettering Cancer Center in New York, a real elite cancer center. And then he did dermatopathology. So he's practicing dermatopathology with Pincus Dermatological Laboratory in Monroe. So he only reads dermatopathology slides as a pathologist. And so across the spectrum, from rashes, which in Swahili we call upele, to the real cancers. So a good story about Israel. Israel and me, we kind of studied together. We marched in the same year to start our residence. And this is a picture of me and Israel in front of my house. And the only thing I noted in this picture, this was the last time I was taller than my son. He's now taller than me. Israel loves pathology. If you don't know what you want to do or / you are not very convinced and you speak with Israel, he will convince you to do pathology. And what I want you to appreciate is pathology is very wide, and there are so many specializations, and that's what Israel will preach to me as we talk around. But he's a good guy, and if you love pathology, he's real here to kind of help you guys and guide you to be able to do what you want to do. So going to the business now. So that's my panel. Thank you very much, everybody, for coming on and, representing the region. I don't have anybody from Rwanda, as you cannot, although I've been advertising and we have Rwandan participating here. So if you know any Rwandan who is currently in the US, who would like to participate in the process, I want to feel like every, part of East Africa to feel well represented. So the aim of this talk is to talk about graduate medical education. And in most cases, it's referred to as residence, but graduate medical education is like the official name. And so we use residence and graduate medical education interchangeably. And in East Africa, the residency is equivalent to MED programs. So we have the MED programs. And what I would like to say is residency and MED are similar and different in many ways. And that's what I'll try to classify and explain as we go around through this talk. Residence is done in programs, which can be in a community hospital or in a clinic or in a university. But MED is almost always, and I bolded almost always for a reason, because it's not all the time done in universities. And what I want you to appreciate is, unlike in our countries, in East and Central Africa, where you finish MD5, you do your internship, and you can go and practice as a generalist, in the US, almost always, the people practice as specialists. So you finish medical school, and then you do your intern, and then you do your residence. So you practice either as an internal medicine, a radiologist, a surgeon, a gynecologist, a pathologist, but you don't practice as a generalist. And so in the programs, when you have these residence programs, the person on top of running the program is the program director. And then the program director is helped by an associate program director. And in these residence programs, most of them will have a program coordinator who's like an administrator who kind of communicates, provide communication. Example, when you're invited for interview, or there's communication for those who are already there, you are doing logistical things. They are there really to help you be able to do your day-to-day things. And I said almost always, because recently there has been people doing surgical training in East Africa through COSECA, which is College of Surgeons of Eastern, Central, and Southern Africa. And so this one, they are not affiliated to a university, and kind of they place their surgeon training across different hospitals. Under surgeons, they work, and then they have the way they do their books and their training for them to complete their surgical training. And that's really the reason where it went. And this is the website for COSECA. It's stationed in headquarters in Jiro, Arusha. And so they train surgeons. So if you didn't know, this is another resource that you should know that it exists. So to gain admission into US graduate medical education or residence, you need to take and pass your USMLE exams. Any medical students in a WHO accredited medical school directory can apply and take USMLE exams. And this is the website I provided for the WHO medical school directory. And when you go in the directory, you can type in any country and see the list of medical schools. So for Tanzania, this is the slide I updated, because for Tanzania last year, there were 8 medical schools listed in the WHO directory of medical schools. But this year there are 11. So there are 11 medical schools. So you can either go by country or go by your medical school. And it's easily searchable. As long as you're in this directory, you can apply and take USMLE. And for Rwanda, there are 3 medical schools. I ran again this year. There are just 3. For Kenya, there are 11 medical schools. They didn't change between last year and this year. And for Uganda, there are 9, and that's the same which I found this year. So you can just Google World Director of Medical Schools. You can go in there, see your medical school if it's there, and if it's there, you can apply. So when you are done, you do your exams and you're done, then you apply for residence through ERAS. And ERAS stands for Electronic Residence Application System. And after applying through ERAS, that's when the programs will screen you, invite you for interview, the way Eligape is being invited for interviews right now. And then towards the end of your interview, you'll put your application in NRMP. This is National Residence Matching Program. This is a program that has been in existence since 1972, so it's almost 72 years old. And what it does is use computer program to assign residents to the programs. If you are a movie lover, there's a movie called A Beautiful Mind. I think it was is based on a Nobel-winning economist who was at Princeton. And the theory which he explained there is the one which they use for the NRMP for the match. So I will talk. We'll talk about the details of this, the ERAS, the NRMP, in subsequent sessions when you're about to do it. At this time, we are only talking about real graduate medical education and what it entails for you to come in. So there are so many acronyms. And so before I engage, and confuse you with the word salad and everything, let's go to the first things first. For you to be able to go to ERAS and the RMP, you need to apply, study, and pass your USMLE exams. So, and the application of USMLE exams starts from you applying for USMLE number and doing your document verification. So USMLE number application is ground zero of what you need to do when you want to pursue US graduate medical education. And so before you do your application now, you go there and apply for the USMLE number. You have to make sure that your names are in order. That's number one thing you need to do. It's good if you have a passport or / national ID, not only passport, even if you have a national ID, of course, you know that the names in the national ID is what will appear in your passport. And in making sure that when you apply for your USMLE number, your names matches to the last alphabet. For example, if you have John Casey with E-double-S-Y and John Casey with double-S-I, or John Casey with a single S-I, these are 3 different people when considered in terms of USMLE number. Or you can have somebody write Mohammed with double M, or Mohammed with single M and E, or Mohammed with single M and I, or Mohammed with, and all these are 4 different names. So you have to make sure your name on your USMLE application matches to the last alphabet. And we Tanzanians, we are not short of controversy of names. I'm a victim of that because I'll give you my real example. When I was born, my birth certificate have 5 names: James, Ignas, Bahati, Tadei, Kola. So when I went to secondary school, I decided I'm going to hide my identity and use 2 names. Through everywhere, I wrote James Ignas. So I came in, I'm going to medical school, I'm registering it to the University of Dar es Salaam, and they're saying, you need to have 3 names. And so I decided I'll be James Ignas Bahati. So my medical school certificate has James Ignas Bahati. And Ignas with CE, not the Ignas with S, which is one I have in my birth certificate. So when I was applying for USMLE number, I had to decide and pick 3 names. So I said James Ignas Kola, the way you see in the title of this presentation, that's my official name. So I had to do a deed poll, published in the government gazette, and it said James Ignas, James Ignas Bahati, James Ignas Bahati Tadei Kola. From now onwards is James Ignas Kola, and I leave all my previous names. So across East Africa, we are all almost under British rule. We follow mostly our laws reflect the British laws. So it's important that you engage a lawyer, follow through, do your deed poll, do your attestations, and once you have your name in order on a government gazette, you can even now, your MD2, MD3, go to your medical school and say, I changed my name is this one, and this is how I'll be known, please change. And so when you do your USMLE application and document verification and everything, you don't go through the trouble which I had to go through to be able to accommodate my name. And be very careful. If you have written your name, example is Mary, Mary with E, Mary with single R, Mary with double R, make sure you are consistent. And that's the way you kind of, we can go forward without any challenges. And I said, some people will say to me like, oh, I'm applying for a passport. I cannot apply for USMLE number, but this person has a national ID. And his name on medical certificate and documentation is what is in the national ID. And you know, beyond the reasonable doubt, your passport will have your name in a national ID. So if you have your national ID, you can go in and put in your application. You don't have to wait to get a passport for you to apply for USMLE number. So just be wary when you do that. So when you have your names in order, ECFMG is the place where you'll go and apply for USMLE number. And for international medical graduates, that's where you do. And I would like to explain, we call IMGs international medical graduate. And this term applies to anybody who studied outside the continental United States. So being an international medical graduate has nothing to do with you being a citizen of America or no. So even Americans will go and study in Europe, in the islands, in Asia. They are all international medical graduates, although they are American citizens. And international students can study in the US, just like the way Professor Minja did, and is an American medical graduate, although is not an American, is an international student. So that's how the terms, don't let the term confuse you. It's just what we use and kind of to do. And in my first talk, I'd said like you need to have like a number of years for you to apply. No, anybody in a WHO registered medical school, even if you're PG1, you just started in October, you can apply for USMLE number today. As long as you are a student in a WHO recognized medical school, anytime you are there, you can apply. So there's no restriction in terms of number of years you need to be in medical school. So when you open the ECFG website, this is how it opens. And the first part is where if you have your USMLE number and the password, you can log in. But you are coming for the first time, you don't have a USMLE number, this is where you will go, whereby you attest that this is the first time you are coming here, you are a brand new person, you have never had a USMLE number in your life. That's where you're going to click to apply for USMLE number. And once you click there, they will give you kind of an attestation to say, you know, you have to put your last name where your last name is. So if you are John George, your last name is George, you are not Georgie John. So you have to make sure what's your last name. Your last name has to go on your last name. And they make you attest to that. So, and at some point, like in the past, somebody was excited and added junior at the end of their last name. And guess what? Their certificate does not have junior, and they return to them saying, hey, your medical education documents doesn't have junior. Are you junior? And then he had to go back and kind of, you know, reattest that I'm not junior and all those things. And that became an unnecessary next step. So what I'll advise is make sure you put your names in order. I mean, you answer a lot of medical questions to your lawyer friends who you went to school with. Now is your time to reap on your benefit. Tell them I need a deed poll, I need to change my name if your name is not in order. And then, you know, you get part of your favors back. And so they make you a test, you know, they make you a test that it's you, it's really, and this is legal binding when you sign it. And once you submit here, it takes 5 business days for you to get your USMLE number. 5 business days, your USMLE number should be coming out. And so the USMLE number, I can't overemphasize. You only apply once in your lifetime. It's the only number you will use if you decide to pursue USMLE. Never, ever try to create another number once you have a USMLE number. If you try to cheat, they will catch you, and it will not end well. So even if you change your names, you change your gender, you get married, divorced, get married, change your name 3 times, your USMLE number remains the same. So what I want you to understand is your USMLE number will never change. It will remain the same. And it's important, to take note of that. Your name can change, it's fluid, but your USMLE number is real rigid. So the USMLE number is free. You don't pay a dime for it. And frankly speaking, to tell you, I've been guilty of using the USMLE number to gauge the seriousness of a person to pursue USMLE. So before we started having these forums, I will use to have like people contact me like, oh, I have my son, I have my niece, I have my this and this, wants to pursue USMLE. And then I will go and give them this talk I'm giving you in a crash for like 30, 45 minutes. All my neck vessels are out. And then I finish, I'll give them a break. And after a month, I'll ask, hey, have you got USMLE number? They'll say, oh, no, I'm still kind of sorting things. And I have noted from my experience, if by that time they don't have the USMLE number, 99.99% in a year, they will not have the USMLE number. They're not going to do it. And so, so it's really what it is, It's, if you think USMLE is what you want to do yourself a favor and today apply for USMLE number. Don't agree to follow in my statistics, whereby you'll go a month and obviously will go a year and you'll be 99%. So last year, through our talks, we had 650 people register for our talks. And from these 650 people, 120 people procured and submitted USMLE numbers. So this is around 18%, where more than 82 did not. They listened on this year and kind of went out using escape velocity through the other year. And so they moved on. It's fine. But what I want you to appreciate is because of technology, and now we can take this and put it in the YouTube, more than 60 people sent me USMLE numbers because they saw the talk on the YouTube. And they'll send it like, oh, this is my USMLE number. Please include me for next sessions. And, I listen to the thing on the video and I want to pursue. So it's helping us create a snowball effect. So for all those people who registered for the talk today, after this talk, we'll send a registered copy of this talk and a kind of a PowerPoint of the question and answers. So they will really get access to all the information that a person who attended live got it. So even if your network is bad, you are coming in and out, don't get frustrated. Don't feel depressed. You will get all the information. You can be at the comfort of your desk, note down and write it clearly. What is talked about, and put your next steps of what you want to do and be able to do exactly or more than the one who attended and did all that. So if you get your USMLE number now in 5 days, you need to go back where I have highlighted for you to establish your account. And this is the first step, whereby you can have your password, and which you'll use your USMLE number and password up here to kind of be able to log in. And so you establish your account, and then you can kind of, start the document verification process, whereby ECFMG will send form to your dean to verify you that you're a student, you're a medical student, you're not a plumber trying to kind of fool yourself into USMLE. And of course, if you have graduated, your certificate will be submitted. If you're not, it's just the dean letter. And the verification process really, the speed of which the verification process is done, document verification, varies. And it depends on a lot of things which are not under your control. And so it's really important that you start the process immediately. You decide you want to do your USMLE so that it doesn't delay you when it reaches a point you want to take your exams, but then your things are not in order. So the sooner you start, the better. And I'll advise that you start as soon as possible. So your document verification will depend on the speed of your dean office response. Is the verified dean the one in the hospital? Because in office, because ECFMG has a list of deans for each medical schools that has ever sent a student through the USMLE process. And so sometimes deans changes. So I started my process, Professor Karim was the dean, the pediatrician in Muhimbili, but by the time I needed another verification of document, they have changed and Professor Kaaya is the dean. So I had to go above and beyond to make Professor Kaya be verified as the new dean for her to be able to sign my documents for me to move forward. So it's not uncommon whereby you want to do a process and you find that there is no designated official from your school. Be the pioneer, follow through and do it. I know University of Dar es Salaam, Mbeya Medical School, they are trying to have their authorizing officer kind of be recognized. They're in the process, they are following. So do that. I mean, one of my panelists, Barbara, she was the first from Kenyatta, Jomo Kenyatta, to do her ECFMG process. And so she had to pioneer and kind of, go through the process to have verifying officer in place for her document to go through. So it's good as you are there, be friendly to the support staff and everything. They are very helpful. I had to go through multiple processes and I knew the secretary personally. I could call them and it's real helpful helping you push the envelope and make things happen. So you should give yourself around 6 months to have the process of verification completed. And that's one reason why you should really start as fast as you can. So the document verification is not free. It's around $160. But once it's done, your documents are verified, they are valid for 7 years. So you have 7 years, which I think is long-term enough. Let's imagine that you are MD2 and you do your document verification as MD2. Guess what? You'll have 3 years of medical school. So when you graduate, you'll have 4 years remaining for you where your documents are still valid. You don't need 4 years post-graduation for you to complete your USMLE. So you cannot be too early. The sooner you do, the better. There's no way you can be too early. Start your document verification and, do justice to yourself. There's no reason to procrastinate. When you are in school, for example, it's easy for you to follow up and have your documents sent. You can do it by yourself. But let's say you have graduated now, you're depending on other people. God forbid you're outside the country. So you're depending even on more people to kind of help you. So I cannot overemphasize the importance of you verifying your documents to ensure that, it's very, it's timely, it's there. It's very deflating when you have studied for your exam, you are ready to take the exam, and your document verification is not done. You are running around fighting bureaucrats. It's very deflating. It's a lot of hard work, and you want to get the best benefit of your hard work, which is to do your exam when you are ready to do your exam and not to bother around doing other things. So in terms of the USMLEs, United States Medical Licensing Exam, that's what USMLE stands for. There is step 1, which is primarily basic science, where you do anatomy, physiology, biochemistry, pharmacology, pathology, AP biostat, and currently is pass-fail. But what I'll advise you very strongly is there's a lot of basic science in CK. So preparing well for this pass-fail exam, step 1, helps you a lot in scoring well in step 2, which kind of have scores. And so if you downplay step 1, you don't have a good foundation, you won't do well in CK, and that will count against you. And this is something we'll talk about as we talk about how to study and those screening and the application process, like how do you stand out and all those other things. So although step 1 is basic science, my personal experience is you will do better when you have done your clinical rotation for people from East and Central Africa. Why do I say this? The basic science asked in the USMLE is basic applied sciences. It's integration. So you won't be able to integrate if you have not done the clinicals. In the US, starting from the year 1, they do medical school for 4 years. Starting from year 1, they start going to the clinic. Their teaching is integrated, where they do, they do the basic science, the pathology, the pathophysiology, and the disease and the medication at the same time. So they come in kind of tucking all the things together. When I was training in Muhimbili, our first 3 years, I never touched a patient for the first 3 years. I was just doing, in the third year, actually, we do management of disease, where I take how to take history, how to examine, and all those things. But this is the exam which had no university exam, and it's the exam which we used to use as our resting point. We used to take it very cavalier. And so you finish your first 3 years, really, you don't have really your hands on your clinicals. You cannot make diagnoses or differentials. And so when you come to be asked these questions, it's gonna be hard for you. And despite insisting on this on my last talk last year, somebody was so motivated, finished their third year and decided to go for step 1. Guess what? They failed. And so it's very important you listen and follow the things that have been tried, because you don't want to experiment on yourself. So given what I will continue to show you, it's very hard. It's almost next to impossible for somebody who has just finished basic science in the way we train to be able. It has nothing to do with your intelligence. I'm not trying to, it's even me. I thought if I was MD3, do step 1, I would have bell flopped. There's no way I would have made it. It's just the way the system is. And so step 2 CK is CK stands for clinical knowledge, is a clinical exam. Now, this one is where you do internal medicine, peds, surgery, OBGYN. Of course, there's some AP and biostat, mostly like clinical trials and all those kind of things. And the exam is predominantly internal medicine. Internal medicine is 50 to 60% of the exam. So it's very heavily internal medicine. And the questions are 3rd degree level of knowledge. There's nothing that is straight. You want to be asked the NH ATP is manufactured in dash dash, you feel mitochondria. There's nothing like that. The questions, they are 30 degree level of knowledge. They are very kind of, you have to know 1, 2, 3 to answer 4. And so it's very important, when you are preparing for USMLE, to use USMLE specific materials, because it's MCQ questions. Before preparing for USMLE, I never had a respect for multiple choice questions. But when I was preparing for USMLE, I had a lot of respect for multiple choice questions, which are written well, because they really test your knowledge. There's no way you can guess. If you don't know, you don't know. That's it. And so I'll give you an example of a question which is in a USMLE kind of question, which I shared last year, to kind of give you a sneak peek of why I say, do your clinicals before you go and attempt step 1 of those basic science. So there's a question saying a 4-year-old African-American boy is presenting to the hospital for the 4th time in 6 months. So he's having multiple admission. I mean, at 4 years old, you don't expect them to be going to the hospital multiple times. In the previous 3 visits, he had swelling of fingers and a yellowish coloration of the eyes. This time, he has pain below the knee of the left. X-ray showing evidence of periosteal elevation. So you are given different labs. So this is a very long question. You are given labs, the CBCs, the electrolytes. You see he has normal electrolytes. He has some mild transaminitis, slight elevated bilirubin. You see he has some anemia there, hemoglobin of 8, CBC, other cells are normal. You are told biopsy is taken from the lesion. What's the gram stain of the most common organism? This will be a step 1 question. And so for you, you have to look at this question. Is African-American, is coming with swelling of fingers, yellowish coloration of eyes. That's jaundice, yellowish coloration of eyes. The swelling of fingers, that is dactylitis. And so for this African-American with a picture of anemia in the lab work, you are thinking, this is sickle cell. Now, with the pain below the knee, with periosteal elevation, that's evidence of osteomyelitis from the X-ray. And now you think that for sicklers, they tend to get osteomyelitis from salmonella, which is gram negative. And that's how you're gonna answer the question, what's the, the gram stain of the most common organism? Can be anything, the most common. And so you put gram negative. But then it can be the same question, but now for CK, and they tell you biopsy is taken, what is the next step in the management? So now you go into management. Now you have a sickler who you have diagnosed now has osteomyelitis. And now what's your next step? What's the best step in the to follow in the management? And is you coming alone and figuring out. So if you are MD3, you're just finishing MD3, you have never been to the wards, you've never seen a sickle cell patient, there's no way you will make up for this question. And it's not that you are not smart, you're a very smart person, it's just you're not trained that way. It's after you have done your clinicals that you integrate your basic and the clinicals that you can be very solid and crack these questions and be able to kind of go them through. So as I said, CK is given a scores, and the score ranges from 0 to 300, where 300 is the perfect score. The passing score is 214. And what you need to know is currently, as of this year, the median score for American medical graduate is 249. What you try to do is to beat the median of the American medical graduates, or not fall more than one standard deviation. Usually it has a standard deviation of like 15. So you are trying not to fall below 234 for you to give yourself a chance showing that, I know my things, I'm a good physician, and increases it. So we'll talk more as we talk about the subsequent session preparation and matching and all those things, but you to have a sneak peek. That's how it goes. 214 is pass mark. And of course, American medical graduates score 249. Most programs will filter if you're less than 230. Most likely they won't call even for interview because, you're not a strong candidate. You're just a few points above the failure number. So you need to do exam step 1 and step 2 CK plus an English test for you to get ECFMG certification. And once you get ECFMG certification, that's when you can apply for residence. And there's USMLE step 3 that can be done after matching, but for IMGs, I will encourage you to do it before residence because it has multiple advantages, among which includes your capacity that if you have done step 3, you can get a H visa and not come with a training visa. Step 1 and step 2 CK can be done in Nairobi and Kampala in East Africa. Actually, there are 4 sites in the sub-Saharan Africa. So I was looking for this. And 2 of them are in the East Africa, Nairobi and Kampala. The other site in the sub-Saharan is in Accra, Ghana. And then another site is in Joburg, South Africa. So we are blessed within the East and Central Africa region where we have 2 sites. You don't need to travel outside. You can take a bus to go to Kampala or to Nairobi to take your test. And so it's really a blessing. And as I was looking through, I was trying to think, I see so many resident applicants from Nigeria that are more than from Ghana. Of course, Nigeria has bigger population, but the site is in Accra, So we are really blessed. We can do that. And when you do the step 3, apart from the visa benefit, from the program perspective, we see you as full residence training capable person, because you cannot finish your residence without completing step 3. Now, if your marks are not very convincing, and then you start the intricate of residence, you are busy, and you are not able to pass step 3, you cannot complete. And for us, people in the program, we really want when you bring in, you graduate. So we hold it upon ourselves to make sure you graduate. And so when you have done step 3, it shows like you are more ready, resident-ready candidate. This is an example I picked from the internet, the way the ECFMG certificate look like when you are done with all your steps and your English test. And it usually shows the dates when you did your test and all other things. And given the uniqueness of USMLE questions, you need to train in a different way to be able to answer those exams. So there are USMLE specific materials that we can direct you to use. And what I want you to understand is reading your traditional books to go for USMLE will not cut. There's no way you will make it. You cannot read Harrison, Kumar, and Clark and expect to go there and nail the USMLE. So we will guide you, and there are materials that you can use. But the first thing you should have is the first aid book. It's one, there are multiple books for step one. I don't get paid by first aid, but I find it to be a very good. I mean, mpe maua yake, who did it? It's an excellent book. So in Swahili, we say, give them the praise that they deserve. You know, it's an excellent book in terms of step one. And it's basically applied. It will show you how things are framed. And they release a copy every year. So this, I updated this slide as well to put the 2024 book. And I will advise that you get your note, you write, you annotate, you highlight. By the time you are taking your USMLE, there should be nowhere to write anything in your book. You have to read it multiple times, you know, to really have a grasp of everything that is inside there, to kind of, you know, put yourself in a way, in a winning position. And you will see like the new book now is around like $46, but you can get an older version for as low as $15, $12. You don't need, basic science does not change that frequently. So if you have a 2020 book and you read it real well and somebody has a 2024 book, which they went through lackluster, you'll do so much better. So it depends on your finances and your resources. You can just narrow down, buy a used book and just work with it. But you need to read your book. You need to read it multiple times. You need to know your things. You need to have your medicine in your fingertips. And this is what I'll talk on the preparation, like what do you need to do to have those things done. So preparing for, why all these hassles? I mean, I've talked about, you know, you're going to read all these long 2-page questions where you have to answer 40 questions in 60 minutes. You know, you're preparing, you're going through, you're applying, you are paying money for verification. Why all these hassles? Why? Why should you do it? Preparing for USMLE enhances your medical knowledge. That's first and foremost. You are able to integrate things more. A knowledgeable doctor is a better doctor all the time, you know. And when you have better knowledge, when you have confidence, you know your things, you are in a position to teach, to lead, to be satisfied, and avoid unnecessary anxiety. What I tell my residents and the people I work with is the eyes cannot see what the brain does not know. You know, you will see somebody with a rash, and for you, you will think it's a rash, but somebody will look at it and say, this is celiac disease. You know, you look at an imaging and you see a mass and somebody will say that is an interception, you know? So you don't, when you have the knowledge, you don't get unnecessary anxiety because then you know what you, sorry, my computer is running out of power. Sure. Sorry, Frank. You don't have unnecessary anxiety because you know your things. And so it's very important that I'm trying to, sorry. Frank, can you talk a little bit? I'm running out of power. I need to.
Yeah, no worries. No worries. Asante sana, Dr. James, for that awesome presentation. I'm sure you may have a few more slides to go. We've had a lot of like questions in the chat already, so looking forward to that. And when our panelists come on, I'm sure they'll add more info. Just to kind of rehash, this is really about the U.S. medical licensing examination. And I think it's people just need to understand these are the examinations you need to pass if you're trying to work in the United States. So that's one. So definitely, if you want to do anything to get employed and practice medicine in the United States, you must pass these exams. It doesn't matter which specialty. Some people are asking ENT, neurosurgery. It doesn't matter. Whatever medical specialty, you must pass these exams. And I think also Dr. James touched upon the whole thing about ECFMG. If you're training abroad, you also have to get certified as a foreign medical graduate. And in order for you to have that sort of certification, you must pass these exams. So that's also the process. So you want to pass the exams. And then last point is you may not want to practice in the United States, in which case just going through these exams is going to make you a better doctor. And that's really one of the reasons I really support these sessions. I support all medical students using first aid because we want to do is standardized medical education across the region, right? So we want to make sure that people, when they're coming to clinicals, they do have some like basic fundamental knowledge, and this is sort of standardized across the continent, across the world for that matter. So I think that's really one of my biggest motivations for doing this. Many people say, oh, why are you guys doing this? You're promoting brain drain or whatever. My point is, if you're a better doctor, you can help patients anywhere. If you're a crappy doctor, you're no use whether you're in Nairobi, Dar es Salaam, Kampala, or whatever. So the point is to be the best doctor you can be. And then after that, you can decide where you want to practice. And then you can decide how you want to practice. So you could, for example, practice in the United States, but still provide services to our populations in East Africa and so forth. So, I mean, really, there is no shortage of opportunities for you to help people across the world and in our region, in the US and whatnot, but once you have the better training. So here, really, the emphasis on at least getting us to a common baseline. And before we let our panel, maybe we'll start the panel discussion, and then maybe Dr. James can join in whenever he is ready. So maybe our panelists can start to kind of get ready to kind of chime in, so we at least do not waste any time. To summarize, after this presentation, hopefully you heard each of you can get a USMLE number. It is free. You should buy a USMLE first aid book so you can start reading it. Even if you're MD1, start reading the book. You will need to read it 3, 4, 5, 6 times to really sort of understand the content that's in that book. And I think that will really make you a better medical student and then a better medical doctor, period. That's really the point of this session. So really the take home here is hopefully you'll get a USMLE number, and hopefully you get the first aid book. And then in sessions 201 and 301, we will kind of keep marching along in the process of this applying for working in the United States or just getting better medical training. So without further ado, let's start by alphabet. And by alphabet, I think first name is Barbara. So Barbara, give us like a 5-minute sort of like summary, your take on it, and your words of advice for our listeners. And then we'll kind of go from there. And when Dr. James joins in, we'll take a break and kind of keep going from there. Karibu, Barbara.
Thank you so much. This alphabet did me in. Should have started with the last name. But my name is Barbara Odak. I'm originally from Kenya, born, raised in Nairobi, went to medical school in Kenyatta University. So all alumni in the chat, hi. It's such a joy and pleasure to be here. Currently, I'm a postgraduate internal medicine resident and preventive. So I'm in a combined program, internal medicine and preventive medicine program. I'm in the 3rd year. So this year, as part of my preventive medicine program, I'm doing my MPH at Yale. So learning about cool stuff like AI. So okay. Yeah. So it's such a joy to always be here and to keep learning. When I was doing USMLE, as Dr. Kula mentioned, there was nobody in my program that I'd ever even matched, or my school wasn't even in the directory. So initially, I had so many battles to fight, including fighting the NRMP to tell them, hey, I've done all these things. I need to input my name into the registry so I can match, but there's nothing. Like I fought every single process to be able to match, but it was well worth it. And now I can have other people follow after me. But I also didn't have the kind of mentorship that is here. So I'm so grateful that this platform exists, because there are people like me who were like solo adventurers, and it was quite hard. So I think Dr. Kula back?
Yeah,
okay.
Yeah, Dr. Kola, we'll just allow Barbara to finish her session, and then we'll bring you back, Dr. James.
Thank you.
Yeah, all right.
Yeah. So this is one of the things I always thought of. I was like, my journey was so hard. I hope nobody else's journey is this hard. So it's so great to have all the nations represented. I saw someone from Botswana, hello, and Taiwan. Oh my gosh. So this is just a great platform, and I hope you all benefit. And I'll take it back to Dr. Kula. Feel free to leave your questions on the chat, and also write your names so that we know where you're from and form connections.
Awesome. Karibu sana, Dr. Barbara. Excellent to have you back and representing our neighbors to the north. Really, really amazing stuff. And I really, the point here is, I can't believe you're like now like in your second or third year. Like, what is this?
Third out of fourth, really. Like when Dr. Kula was presenting the names, I was like, oh my gosh, I'm getting so old. I'm getting old. Like my name, I was like, oh gosh.
Wait until you get to my side, and my kids think I should be in a nursing home by now. Congratulations, time flies, and this is just a testament. I want to hop on that point. Many times when our MD1 or MD2 students hear, oh my God, it's gonna take 18 months. They feel it's like an eternity. I'm saying, oh, it's gonna take you 2 years. I think it's like an eternity, but really, 18 months really is a little like, it's 2 pregnancies and boom, you're done. And basically there you are. So it goes much faster than you think. Karibu, Dr. Kula, to hopefully you'll be wrapping up your side, and then we can give our panelists some time. Karibu, Dr. Kula.
I'm real sorry.
Don't worry about it. Karibu sana, karibu.
This is
yeah. You want to go presenter mode?
Yeah.
All right, awesome. Karibu.
Presenter view. I need to set up everything else. Let's talk a little bit as I'm setting up my things.
All right.
Excellent. So I'm real sorry. This is untaught. I didn't note that my computer was not being charged. So it kind of, the moment I got an alert, I was off. So this is not being prepared. So I was saying,
you still have the other, you want to go the other setting. Go to display settings, up top. Before, like near like show taskbar to your left. Yeah, display settings, drop down. Swap or duplicate slideshow. I'm not sure what your monitor setup is. Yeah.
Can you see my slides?
Yeah, we can see your notes also.
I wanna.
Yeah, so you may want to duplicate slideshow, whatever the other one is. Just pick the other option. Usually works on the display settings.
I wanna do the advanced setting. I don't see the advanced setting.
Yeah.
So you say you can see my notes still?
Yeah, we can see your notes.
When I came in, I'm not having so much.
Yeah, try the display settings. The other one is to basically stop share and share again. So those are the 2 things that should reset.
Stop share.
Yeah, and then basically go into slideshow, and then start sharing screen after that.
PowerPoint slideshow. USMLE now PowerPoint. It usually used to give me a point to do advanced, whereby I can just select, but this is not allowing me to select. It's saying my screen share has stopped, kind of.
Yeah, now it's starting. Yeah, it's still going back to the same thing. So go to display settings. I think it's probably that's what's gonna help you fix it.
So that's the slide, because I used to be able to do advanced from here and be able to show a portion of the screen and share a portion of the screen, and then this is it.
Yeah, that's it. Oh, okay. All right. You're not saying sharing.
And then I can narrow down and just show you.
All right. Sounds good. All right. Sounds good. Perfect.
And let me move these things off there. Sorry, guys. This is the hiccup.
No worries.
So I say, why all these hassles? I mean, like, why do you guys do this? And I think I was here before. It enhances your medical knowledge, whereby you as a physician, really, we are students for life. Like, medicine is evolving. Just see the way COVID came. Nobody went back to medical school to learn about COVID. We just picked up, train ourselves, and start taking care of our patients. So you choose to be in the medical field. You are a student for life, and that's what you should embrace. So as much as I say that, USMLE needs strategy, needs all these things, what I want you to appreciate that among American medical graduate, 98% of people pass the exam in their first attempt. So only 2% fails. And so it's very important for you to see that it's not really that hard if you prepare well and you have the right resources in place. And this is what I'll be doing when I talk about preparation strategies. Really, this is the exam you can go in knowing that number you're going to get plus or minus 5. You know, you can be that precise what number you're going to get in this exam. And so it's very important that you follow up on those before you go. Don't just sneak out, prepare in the hideaway and go and take your thorax in there. When you're in medical school, you used to say when you're going to take the exam.
Dr. James, did you want to put your video on?
Is my video not on?
Yeah.
This is okay, crazy.
A
lot of things. Yeah. All right. So now I'm on, but
yeah,
I can't see myself. I hope you can see me well.
Yeah, we're good.
Okay. So what I'm saying is you can know how you're going to score. And in medical school, is to make a joke when you are going to take the exam when you're not prepared. Is like I'm taking the thorax. You know, you don't have a head. You're taking the thorax in there. So you do that, you'll be real surprised. But if you prepare well and you put the effort, you should be able to do well. So it enhances your medical knowledge. So I mean, you are able to kind of do things. I said that. In Tanzania, for example, now we have pre-intern and post-intern exams. So if you prepare for USMLE, you do very well in these exams. There is no one preparing for USMLE who has failed pre-intern and post-intern exam, which is known to have failure of up to close to 50%. So nobody, and they'll finish the exam in record time. You know, they go in and walk out like those questions were too simple, you know, because they know the things they can handle. So, but most importantly, it positions you to be able to do residence training in the US. Now, remember I said residence and MMed are similar and different. Unlike NMed, when you do residence, you don't pay fees. And once you match in a residence in the program in the US, you start receiving salary. While in MMed, you continue paying fees and depending on pocket money from your father. So somebody is paying for you to get your education. So what you look at is I do my USMLEs, I do what I'm supposed to do, I'm ready, I match, and somebody is paying for my education. So it's a good trade-off. So if your father was to pay for you for your MMed, you can tell you the money you'd have paid for me for MMed, let me do the USMLE. And when I do USMLE, I'll start getting paid between $5,000 and $8,000 a month. You know, you convert it like 13 million Tanzanian shillings. You can live pretty well. And so you don't have to ask. I mean, your 11 years old young brother is lining up at your father's desk, you know, asking for pocket money, and you're asking for pocket money to go and do your MMed. I don't know how you think, but growing up, nothing used to drive me like making my own cash and not begging for money. So that's the benefits. Those are the benefits if you decide to pursue graduate medical education. So training in the US give you exposure to highly specialized training. So you can get the skills and transfer them back home. See, like the things, you know, which people are trying to do home to enhance care to our own people. So, and in the US, when you do the residence, you can finish the residence, then you do super specialty training that is called fellowship. So somebody will do residence in internal medicine, do cardiology, and then do electrophysiology. What do? They just do electrical activity of the heart and pacemakers. That's the only thing they do. So you have access to those kind of super specialty training. So you can advance and do very advanced training, or you look for one of our panelists here, Dr. Kasago. He has done pathology, he has done molecular, he's doing dermatopathology. He's just doing dermatopathology. He's not doing no autopsy. He did autopsy in his residency and that's it. He's just reading skin issues, you know, starting from upele all the way to melanoma and etc. So it's, you get to be trained, you are in the cutting edge of science, you can participate in innovation, you can do high-powered research, and all those, you get those exposures when you go through the residence training program. So as a US trained and certified physician, you can practice in many countries in the world without doing any exam. So it opens the world for you. And of course, and that is because the SGME, which is the organ that moderates residents, is very stringent. And so residents come out of training very highly trained, and the people, they are trusted, you know, in most countries in the world to go and just start practicing. So what are the next steps? Starting from the first weekend of February 2025, we'll give an overview of how to prepare for the exam. How do you dissect and, crash those questions to be able to, what are the study strategies? We'll share in those. What are things that has been proven? How should you follow through? So that to help you in the process. And this will be for the people who are in the process. We are not going to advertise. There will be no Zoom links for everybody to sign in. Those people who send to us their USMLE numbers are the one who will send them the link to register. And we know you will be looking to make sure nobody is sneaking in. This is the one, it's the only talk that is open. Anybody can come in, even somebody driving in Kokoteni in the street can come in and join. It's fine. But for 201, 301, you have to have your skin on the game. You have to have your USMLE number to come for 201. And of course, as I'll say later, for those other training, there are also other requirements. And so in May 2025, the first week, we want to go to talk about the application process because the residency application comes in September. So it's kind of how do you make your application stand out? How do you get your references? How do you get all your things in place? And so, first things first, you have to start from the early steps, but going forward, it's really trying to help those people who are helping themselves. And that's what we'll want to do. So you apply for USMLE number, you get it in 5 days, send it to this email. My moderators write it in the chat box. You can copy and paste so that you don't send it to a wrong email. USMLEpursuit@gmail.com. Send us your USMLE number. We'll put you in the group, in the cohort of people who have USMLE numbers. And that will earn you a ticket to come to our session 2. And then hopefully session 3, when you are done with your exams and you are ready to apply. We do not sponsor or run any WhatsApp or Telegram groups. Yeah, this studying is one thing that you only have to do it yourself. Never mind how much you love your family member, your lover, or anybody, you cannot study for them. And so we let you guys, we support you from a distance, and we want you, to be able to do and pursue it well. So our job is to show you the resources. It's you upon yourself making a decision, reaching that in a aha moment. I want to do this. Put your head down and get done with it and be ready to apply, and we'll be here to support you. So what do you need to do actively now, starting from now going forward, if you are thinking USMLE is your way? If you're a medical student, consider exploring those electives. In 4th year, when you have done your first year of clinical under your belt, look for electives in the US, come get clinical experience, meet other medical students, kind of familiarize yourself. Exploit the collaboration that your schools have. I know Bugando, they work with Cornell, KSMC, they work with Duke, Muimbili, they work with Dartmouth. Try to see, when those students are attending, come, try to orient yourself, discuss with them your interest, and people will be there to help you. Things don't happen by chance. You have to have deliberate effort. Dr. Mbonde, who is the neurologist, he loved neurology. He met an attendant from Mayo Clinic who went to Mbarara and kind of connected, did his exams, and he came to do his residence at Mayo Clinic. So things happen. You create your own story. Try to find ways to do. And these are 2 MD4 students from Tanzania. They are doing their elective at Dartmouth. I heard about it, make an arrangement for them to come down to Connecticut. So I gave them a quick tour of my hospital, and this is in front of Griffin Hospital. And when they went, they met actually Otiol and Barbara. So it was super, double edge, getting to meet. I took them to Yale. This is in front of Harvey Cushing Library at Yale. It's the library of the medical school. And it's named after Harvey Cushing, the person who described Cushing syndrome. And so it was in 1912, was an American neurosurgeon, a faculty at Yale. So I took Brendan and Clara there, just to give them a quick sneak peek and kind of try to inspire a few minds. I'm not promising I'll be able to kind of cater for all of you, but it's just to show you need to explore these opportunities and to be able to succeed. And as I'll insist again, coming to subsequent talks will be by invitation only. Get your USMLE number and send it to USMLE Pursuit, and let's move on.
Shukran sana Dr. Kola for that awesome presentation. And thank you for being flexible. I think they got to see you in real time, basically managing to kind of navigate. And really, that's really the kind of spirit that all of our applicants need to be and be flexible. So you have to like do things in real time, you know? So I think that's an important part of this whole experience. Now, I want to give every one of our panelists 5 minutes to kind of just share a little bit about yourself, and then we can go back to questions. There are a couple of questions that have kind of been coming up, and maybe you can sort of address them if you want to, but please go ahead with your 5 minutes and go ahead, just like Dr. Barbara was able to share. I think next one on my alphabet here is going to be Husband Magacha. Karib sana Husband.
All right, thank you for this opportunity. My name is Husband Magacha. I'm originally from Tanzania. I went to Cuba for medical school, and after that, I came here to US for a master's in public health. My dream was always want to do USMLE and get to residency, so I didn't have this kind of opportunity for people explaining me how to get into residency. It was very, very challenging initially for me, just like a lot of you guys who are in this position right now. But the good thing is that you have people explaining to you how to get into residency and how to do the whole process of USMLE. It's a very, very good opportunity you have right now that you have to use it and take the necessary steps that you need for you to be able to get into residency. So came here for master's in public health. I did all my steps. I did step 1 in Uganda. That's where I took my step 1, and then I came here, took my step 2. Then did my step 3. Now I'm in residence PGY2 here in East Tennessee State, and I'm looking forward to do gastroenterology fellowship in intervention endoscopy. But USMLE is quite challenging for a lot of people, and it's very expensive. It's an expensive process for sure, but at the end of the day, it's worth it. You don't have to think more of the cost that you'll be running through every kind of exam you'll be paying. Every single exam is almost $1,000. It's quite expensive, but you don't have to think about that. You just have to focus on your goals. Once you get into the residency, that is not, it's worth it. So you pay back all what you use for and all this expenses you've been through. It's all traveling, doing all the practice exams. It's very expensive. But at the end of the day, what you need is to accomplish your goals. It's very competitive. There's a lot of people doing these USMLE exams, people from every countries. And at the end of the day, you have to take a shot and do your best. Try to be competitive as you can to apply for residency. So use all these opportunities you're given right now. Ask all the important questions that you need to know about the USMLE residency. To get registered for ECFMG, get your ECFMG number, send it to us, and then we can invite you for second talk where we can go through on how all the steps you need to go through for your application. But at the end of the day, I know you meet a lot of people. Some of them you'll be discouraged for your residency, but you don't have to focus on that. Just keep doing what you're doing. I know for me, sometimes it was kind of challenging when you meet people and they discourage you. But when I had people like Mabuz, Dr. Kola, it's kind of encouraging me. I knew the very first time that I knew about USMLE was through Mabuz. He went to the same medical school. So I didn't know anything about that. And I was like, I don't know anybody in the US. I don't know how can I pay for these expenses when they tell you $1,000 like that. I was like, man, I don't even have that money. I don't know where can I get it. But I'm here today. So it's just that it's not about who you know, but it's all about your goals and how willing you are to do the necessary steps for you to be able to come into residency. So everything is possible. Just keep trying, keep doing what you're doing.
Awesome, husband. Which PGY are you? I can't keep up with you guys now.
I'm PGY too now.
Man, all right, man. Very soon I'll be collecting my commission. Good stuff. Excellent news. Excellent news. Thank you so much for those comments. Thank you also for commenting on the fact that there's a lot of discouraging information that floats out there, especially on social media and Telegram groups and WhatsApp groups. So it's kind of like what I call psychological warfare. Where people are kind of discouraging others from applying to kind of increase their own chances. It's kind of like silly, but again, which is one of the reasons also we don't really encourage people to get into these like mega social groups and whatnot. Really, the steps are well known. You really just have to sit down and study and be strategic about it. I don't think you really want to have a lot of conversations about, is it possible, is it not possible? Hopefully after you see 10 panelists, the question of whether it's possible has been answered for you. So now you just have to figure out what are you gonna do to kind of like, keep going. Israel, I think you're up next on the alphabet. Karib Sana.
Asante. Thank you, Dr. Minja. You can hear me?
Yeah, go ahead.
Right. Yeah, thank you, Dr. Kola. Right, so yeah, my name is Israel Kasago. I'm a dermatopathologist. I did my medical school in Tanzania. Of course, I was born and raised in Tanzania. I went to Kilimanjaro Medical Center back in Moshi, and after that, I came to the U.S. I did my residence at Albany Medical College in upstate New York, and then a couple fellowship, and now I'm working as a dermatopathologist in Michigan. So just to highlight my experience throughout my journey from Tanzania to where I am, I think you have to think of the USMLE exams as just one river that you have to cross, and you have to cross it very well. We are all here to help you plan this process and so that you can execute it in the very best way. I remember coming across the step 1 USMLE textbook when I was in my 4th year of medical school. And from that point, I couldn't put it down. And for me, what was most helpful was to utilize the opportunities that were around me. I remember at that time, there were visiting professors from the US that were, coming, ENT surgeons. So I expressed my interest at that point, that hey, I'm preparing for this exam. I would like to come over to the US and do electives. And, that's all I had to do at that point. And this happened for me. They invited me to the US. I came here, and it gave me, it did highlighted what I needed to do during those rotations. I came back to Tanzania. I did my internship. After my internship, I spent a very good amount of time preparing for the step 1. I passed. I came to the US. I was doing electives again in pathology. I did my step 2 exams, and I applied for residency. And during that time, there were some programs which were giving opportunities. I mean, could recruit you outside the match, and that's the program that I got into. I got into one of the programs that gave me a position immediately. So the process, but most people go through the match anyway. So what I would like to, stress is that you have to plan ahead because you have to do very well on the USMLE exams, and you should not invent the wheel. You should do the things that people who have done very well did, so that you can do very well. I mean, I think Dr. Kola will go through the next round of the USMLE 1 or 2, how to do very well. Of course, you have to use Q banks, question banks. There are specific books you have to use. So you have to execute this process in the very best way so that, you score the high. And you have to embrace your, the opportunities around you. As I stressed, I mean, if there's a hospital, they are visiting, professors from the US who, come and visit, you can find like a clinical case. You can say, oh, I have this clinical case, I'm writing it up. Could you mentor me so that I can publish it in some international journal that is renowned? You can write that up, and they can be your mentor, and you can publish that. You can do that as you're going through medical school. You can do that as you're going through internship. These are all opportunities that are around you, that can enhance your profile even before you go into the application process, okay? And the other thing I would like to point out is that this is a very competitive process. It's a very competitive process because imagine my classmates, the people that I went through residency, okay? I went to guys from Lebanon, guys from India, guys from Syria, guys from Cuba. The guy from Cuba, he was my classmate, okay? We went through residence together. He was a professor from Cuba, okay? The guy from India, they were pathologists. These were guys who were pathologists in India. Now they applied to come and do pathology in the US. You know, the guy from Lebanon, the guy from Syria, they were all pathologists. So you have people coming from all these countries in the Middle East that are already, battle tested and they're experts in their field. So you have to prepare, you have to prepare yourself that you're walking into a very competitive area, So right now, if you're in Tanzania, you're in Burundi, you're in Malawi, you're saying, oh, is this too late for me? Maybe you're doing internal medicine. It's not too late for you because that is something that can enhance your profile, So it's not too late to you, do the exams, that the internal medicine you have done, the ENT, you're an orthopedic surgeon, whatever you're doing, that can enhance your profile, okay? I've met a couple of guys from Iran who are already radiologists in Iran, and they're applying for radiology in the US. So they're coming as a full radiology. When they're coming to these electives, clinical rotation, they know what they're talking about, okay? They're engaged. So that's the third thing I'd like to point out. The third thing is you have to be aggressive. I've met people who have told me, oh, I cannot find a clinical rotation. I remember in my experience when I was doing that, when I was looking for pathology rotations, when I was back in Tanzania, at that point, I just finished my internship. I just passed my step 1 exam, and I was making phone calls. I was making phone calls to John Hopkins. I remember calling John Hopkins and say, I'm looking for a pathology rotation. Can you find something that is available? Whatever, like rotation, whether GI, gastrointestinal pathology, genitourinary pathology, whatever it is, I'll take it. No, they said, no, we don't have surgical pathology this time of the year. Let me look what is available. She said, oh, there's autopsy, like postmortem forensic pathology. I don't think you want to do that. I said, I'll do that. Okay, give that to me. So I was like, because I know you don't have to go through door number 7 you don't have to go through door number 4. Okay, if you want to get to room number, you can go through door number 7 to get to room number 4. So my idea was that I just need to get there. Once I get there, I'll find my way to the other side. So I went to John Hopkins, I did this forensic rotation, and somehow I found my way into surgical pathology, because once you're in there, it's one department. You can go to the other side and sit with them, and you can talk to the chief resident. You can say, hey, I'm here for 2 months. I want to do a presentation on my last week. And you prepare a presentation, and you do that. That gives you a letter of recommendation. That will give you letters of recommendation. You have to be engaged while you are there. You have to show that you belong while you are there. You cannot just be sitting on the side. You have to, really, talk to people, tell them what you're doing. So the US, just passing the USMLE is just like getting an identity card. Here is my identity card. I am serious about this process. Okay, so what next? You have to build these connections. You have to build this network. You have write these case reports if you can do them. Yeah, people have to know that you're engaged and you're serious. And yeah, that's all. Yeah, in Tanzania we have this word, we call it kiherehere. It's like show off, but here there's the so-called kiherehere, constructive kiherehere. You have to like really, when you are there, you have to engage the knowledge. As people have to see the knowledge melting out of you. So this is something that we don't do as much back home because it's taken as being showing off. But here, it's not taken as that. It's taken as someone who's engaged, someone who is there. If you are here for rotation, there's a Juno Club going on Wednesday. You have to read the paper, read it twice, read it thrice. when it's a Juno Club session, you have to engage. You have to show that you're present. So that is something that I will stress. I mean, for you to get the most out of this experience.
That's excellent, Israel. I really appreciate you mentioned that. Also, Tanzania are very reserved because I'm so smart. They should just know that I'm smart. Like,
right.
Quiet. Like, it doesn't work that way. And then we also have a lot of visiting faculty who come to the Tanzania, whether Muhimbili, KCMC, Bugando. There are tons of like folks from the US who are rotating there. And again, learn how to engage in those environments, but you engage it constructively, meaning by preparing. So it's not just like talking without knowledge, because that doesn't really help you. So if you haven't read the paper, don't pretend to just talk as if you've read the paper. You have to do the homework, and then you can show that you actually know what you're talking about. That's really, really great. And thank you for sharing those experiences, your persistence. Again, I remember when you came up to Yale for your rotations and all of that, and now big shot attending. So the whole idea about basically knocking on opportunities wherever you can find them, it really, really applies to this process. So now we're going to Mabusi Mangaro, and then we'll finish Otioli. While I'm doing that, Dr. Cole, I think you can line up the questions about when is the best time to apply for step one, and then to study for step one. And the other question was the World Medical Directory. So I'll give you some time to kind of prep for those. Karibu Mabusi Mangaro, and then we'll go to Otioli. Karibu Mabusi.
Well, thank you. Thank you so much, Dr. Minja. And thank you, James, for inviting me in this session. I mean, everyone has said, I think, nearly everything which has to be said, but I would just like to echo on what other people have said so far. What I would just like to tell everyone, the process is not easy. You just need to work hard. Everything is like the process is very expensive. You need to work, get some funds, and also, work hard, study and do the exams. But also, when I went to my to chess conference this year, I found some colleagues from other countries who, just applicants presenting their posters. So I think it's a good opportunity if you already know your interest in specific area. Just try to see if you can also come here, present a poster. I think back home in Tanzania or other countries in the region, we have a lot of cases. If you're in clinicals, you can see. Write them up, come present, and that will give you a big thing in your CV. So all the best, everyone, and hope we meet you in this side.
Asante sana Mabusi. You didn't say anything about yourself and your journey.
Okay.
Yeah,
I'm right now PGY2, doing internal medicine. I have an interest in pulmonary and critical care. I trained in Cuba, and then I did my internship back home in Muhimbili National Hospital. After that, I worked for some time while I was preparing for my exams. I came here in the US. I did some rotations with some attendings here who were very welcoming to me. Did some rotations. By that time, I did do application in general surgery and internal medicine. I interviewed in both, and I ended up matching in internal medicine. So that's my journey.
Awesome. Asante sana Mabusi. Excellent work. And you guys, I'm always like so proud that you guys are now like PGY2. Before you know it, you'll be on to fellowships and so forth. Karibu, Dr. Otioli. I think you're next, and then we'll go back to Dr. Kola. Karibu, sir.
All right. Hi. Thank you, Frank. My name is Dr. Otioli Wambalaba. I'm a PGY2 internal medicine resident at Griffin Hospital. I was born and raised in the United States for the first, I'd say, 14 years of my life. So that's why I kind of sound this way. There's a bit of a Kenyan twang to it, but I did my undergraduate at University of Nairobi. I'm the class of 2015. After that, I was working at MP Shah Hospital up until around 2023. And, until I started my residency over here, internal medicine. So I think one of the main things that, most people have said and what I kind of want to harp on with maybe just a tiny bit of a difference is I would say um, this is a process. It's a really long process and everyone's journey is their own journey. So preparing for that journey is very important and preparing for opportunities is also more important. So the earlier you can start is I'd say the better because if you're in med school, usually that's where you get some of these opportunities for electives in some of these places. You'll find some of our faculty or some of our universities have partnerships with other universities. Dr. Kula had mentioned that earlier. In my case, University of Nairobi had a partnership with University of Pennsylvania. And through those, they have like maybe 2 slots a year for some of our students to go over there. You still have to fund yourself, but what that does is it gives you the opportunity to, I would say, learn and practice as a student over there without having to now, let's say, pay the program. And it also gives you what they call clinical experience. Clinical experience has a bit more weight than observership experience because the clinical experience, you are treated exactly as the med school students over there. And if you can get 1 or 2 months over there, it adds to, I would say, the power of your application. If if you don't get that, that's not the end of the world. There's also observerships that different programs do. Observerships are a bit different than electives because you might find that yes, you can talk to the patient, yes, you can clerk the patients, yes, you can sometimes write notes, but usually you're a bit less, you're more limited in what you can do. Like you won't be able to, let's say, suture a patient or and whatnot. But those ones are still good because both of those opportunities do give you the chance to network with individuals. So after I did my electives, several years later, I ended up doing an observership in Portland, Oregon, and that observership wasn't an observership that hospital actually had. It was through networking. A friend's father who had a good place there. They created a position for me to do an observership there, and during that observership, you meet people. He connected me with internal medicine, I'd say program director. And through those interactions, you can get letters of recommendation because letters of recommendation have different strengths. You will need multiple letters of recommendation when you're doing your applications. So setting the groundwork for who's going to write those letters of recommendations are important. And fortunately or unfortunately, letters of recommendation from someone who's a practicing physician in the US does carry a bit more, I'd say, objective weight in the application process. So it's good to at least get 1 or 2 letters from these sites. If you don't get them, it doesn't cut you off in any way, but it definitely adds to your benefit. And I'd say last but not least, your journey is your journey. I took you should have a good reason why what's inspiring you or motivating you to pursue that journey, because through the ups and downs, it's what's going to carry you through. So what used to carry me through was one of my seniors. His name was Dr. Mago Mary. He used to tell me, when he was applying that he would see his colleagues, they've done their internal medicine, they're almost finishing, they're almost consultants or they're already consultants. And they would sort of look at him and discourage him, like, oh, you're still a medical officer, what are you doing? This is you're wasting your time. And he ended up matching, and he's already now, I think, a Pulm Crit fellow right now. So I used to remember that because I also saw my own classmates and everyone becoming consultants and everything. And then you'll find that even though they don't directly try to discourage you from this process, you yourself can feel a bit discouraged because you're seeing people moving ahead and you're still working on tests. and, you know, applications and all these things. But that's what got me through, and that's what kept me focused on my goal. And eventually I got it. And, you know, it's those types of interactions that, or at least motivations that kept me going. And now I'm here.
That's awesome. Thank you so much, Otoli, for sharing that. I think it's really, really important to see what is possible. And I think that's why Dr. Cole has done a lot of work to include you guys as panelists, because really seeing is believing, and always having examples of people who have actually succeeded through the process can help you when you're trying to get discouraged, or you kind of hear other chatter that's usually not helpful and not exactly encouraging. So I think having examples and mentors, by the way, and I always insist that nothing that you're trying to do, you're the first one to like figure it out. There are many people figure it out, they've done it. Often they've done it much better than you. You just have to find those people. And usually people are very open and kind of sharing. So also the thing about seeking opportunities for electives, seeking opportunities to get letters of recommendation, those are very highly encouraged. And also for those who are still medical students, in some ways, it's easier to get a clinical experience while you're still in medical school than after medical school. So, you know, for MD2, MD3, it's just consider that, hey, you know, may find yourself spending a summer month in the US or abroad. You could actually tag in a clinical rotation during one of those travels, and that will really help in your application process. So I want to take it back to Dr. Kohler on those more technical questions, and then we'll open up for Q&A. Dr. Kohler, if you may come back, there were two questions that
did Roland spoke? Roland?
I didn't see Roland unless
Roland
you can make him call.
He's one of our panelists from Uganda. Give him a few minutes and then
Roland Samakula. Okay, yeah. 1 second, let me make him call, and then I can see him easier.
Okay. Roland, welcome. Unmute and
yeah, Karibu Roland.
Hi,
Roland.
thank you.
Karibu. Yeah,
hi,
give us a
everyone.
few words about yourself for 5 minutes, and any words of advice to our juniors.
Hey, I mean, it's really brilliant what you've done. I don't think I can really add on to anything that has been said. The previous speakers have really kind of comprehensively hit the ball straight out of the park. You've really touched on every aspect of it all. And in a way, I'm in my first year of residency. And so I'm kind of just learning from all of you now.
When did you decide to apply to the US, and why?
Right. So really, the first time I heard of the kind of a journey to start on my USMLE might have been as far back as 2018 when I was doing my internship. I kind of worked with some physicians from Texas Children's Hospital who are setting up a pediatric hematology oncology fellowship program in my country at Mulago Hospital in Uganda. And, you know, I was kind of like a very hardworking intern, and they decided to tell me that, you know, you could consider wanting to do the USMLEs. It's 2018, and I only matched in, you know, 2024. So it's a long journey. You know, it's kind of one of like, you know, walking the straight and narrow. It's incredibly challenging. I mean, I tell people, like, if I was to be paid $1 million, if I have to go through this again, probably would turn down that money because that's how hard it is. But it's very rewarding once you're here.
So you heard about this in 2018. When did you start studying for the USMLE?
Right. So 2018, I started studying in 2022. I think that's when I started studying. Yeah. So I started my step 1 in July, step 2 in September, step 3 in December. Just kind of got them out of the way at the same time.
Nice.
But I could say that for me personally, what I would say worked for me is the networking. As I said, I had those physicians from Texas Children's, Baylor College of Medicine. I made sure I participated in QI projects with them. And I think one of the panelists mentioned it, but those things carry a lot of clout. You get a chance to present at an international conference, like I did. I presented at an International Society of Pediatric Oncology called SIOP. This was held in Barcelona. Those sort of things really carry a lot of clout on your CV. And also it depends on what type of residency program you want to apply in. Pediatrics is competitive, may not be as competitive as some of the other disciplines. Like I never did any rotations in the US or anything, but I think I had a very firm kind of clinical foundation in, as I worked as a medical officer. Yeah.
I like the fact that, pretty much you confirmed the 18 months to 2 year sort of runway from step one to kind of like matching. That's one. I'm curious why it took you 4 years to decide to start studying for the exam or taking or whatever. Like 2018 to 2022, like why did it take you like a while to study and say, you know what, now I should go for it?
The answer is probably because we didn't have such platforms, Every platform I came across was just discouraging and disheartening. And they'll be like, oh, all these immigrant programs in New York where residents keep committing suicide and things like that. And residency is so hard and it's so expensive. It's why I started off by thanking all of you, because this is very important. You're most likely going to find more negatives than positives out there. It was also very expensive, as been mentioned. I actually think that that's one of it's a very realistic factor. It is quite expensive. I still have loans I'm paying off right now, but very easily now that I'm earning in dollars, I have to say. I could literally clear them all of them now. But those are the factors. It was very prohibitive in terms of the money, especially when you're getting the reading materials, which I think you have to do well. And when you do, as has been mentioned, you just become an excellent doctor. But I think that you also kind of need to take it very seriously in the sense that when you do start your residency, you can tell, people can come in with very fancy high scores. And I didn't get the best scores. Okay, I'll be very honest. I got like a 237. But as I said, I did a lot of networking, and Americans value work ethic. They value enthusiasm. They value your attitude, perhaps even more than just kind of like, organic scores. So, but it can also show you when you're discussing cases, when you're giving presentations, how articulate you are, these sort of things kind of just manifest. It kind of shows you someone who kind of learned material just to learn to pass, and someone who kind of tried to keep that for long-term memory use. So as I say right now,
that's a very important point. I want to really maybe hop on that. Getting 270 is actually not the goal of USMLE exams, and neither is it really a test of like your intelligence. So really aptitude and attitude actually carry a lot more, right? Because it's a training program. We don't expect you to already know everything about internal medicine or pediatrics. We're here to train you, right? So really what we want is to know that, you know what, you have the potential to be trained, you're trainable, and a lot of that comes from your attitude and again, the work ethic. So that's why publications are good, because they show that you're able to follow something from draft all the way to publication. Presentations and meetings are good because you have to submit and you may be rejected, you may be accepted. Participating in like research projects, presenting a journal club, all of these things show that you have initiative, because again, during our residency training, a lot of it is going to be self-directed. And so if you have to be reminded all the time to do your work, hey, please review this paper, hey, please, do this, then it's like, dude, I mean, that's not going to be a very fun person to train and so forth. So I congratulate you on that, and you'll be done before you know it. So, worry not, that's like no time. So don't feel that it's been too late or whatever. It's like, it's so funny when you guys say that, I begin to feel even older. You're like, oh my God, I was wasting so much. I'm like, dude, you're just getting started. It's like nothing. It'll be done before you know it. So again, as we're headed towards the end, Dr. Ignas, if you could, if you could just come in on, for medical students, when is the best time to take the exam?
Before I comment in, can we hear a few words from Eligape? He's our applicant this year. He's...
I didn't see
Come on, Eligape, quickly, a few minutes, and then we move on. I start answering those questions.
Sure, thank you. Hello, everyone. I would like to thank Dr. Kula and the team for actually inviting me and mentoring me throughout the journey. So I'm currently dancing in the fire, but I'm dancing because of these people that you're seeing here presenting. Literally, I did the exam within a span of, I'd say 10 months. I know that's below the average that you've spoken about, but this is because I got a chance to interact with Dr. Kula, Dr. Minja, and Dr. Edward Mtui from Tanzania. And these people really propelled me because they added me to this Tanzania physician group, and I got the energy to just go through the exams quickly and finish. And I'm here now applying for the match. And just to not to repeat whatever has been shared already, I would like to just stress on 3 important things for Tanzanians and East Africans who are applying. The cost for doing the exam is very high. So what I would advise is, don't think about the whole amount. Yes, you can decide to do the exam, but first of all, chunk it down. I want to do my step 1, then think of how you're going to pay for that. And in the end, after you pass step 1, step 2 will come in step 3. That's how we went through. And another thing is, make use of these people here, because they've been the ones who have guided us throughout the process, giving us the right information. As you know, out there is a lot of information like has been shared here. Get the right information through mentorship and team up with colleagues who are doing the exams. But also in Tanzania, there are very good opportunities on research. I don't know about other East African countries, but Tanzania, at least KSMC, Muhimbili, Buganda, big universities, there's a lot of research opportunities. So make use of that. Publish if you can, but present, and that will improve your profile, because as time goes on, the scores really matter, yes, but your attitude, like has been shared here, your publications and any other things that you have that can make you a good candidate, you need to have them on board. So work on everything you have and stand out. Yeah, that's it.
Best of luck, Agape. Keep up the good work. Yeah, 10 months is definitely that's a sprint. We like to think of this as a marathon. I usually my estimate is usually 18 months. 6 months per exam is roughly where I usually pace people, depending on, especially if you're already doing something. Let's say you're doing during internship and you have a regular daytime job. I think like 6 months per exam is probably about right. And so that can like get you. But again, if you're able to do full time and this is the only thing you're doing, which is what the Iranians especially tend to do. So they'll come to the US and be like a postdoc, and they will just basically be a postdoc for a year. And during that year, they're just basically studying for the exams. And that's how they kind of like end up doing. So if you're able to do that opportunity where you can have protected time away from clinical work, because clinical work is much more unpredictable. But if you have a predictable schedule, then probably you can do it in less than a year or so. So Karibu, Dr. Kula. I definitely want to kind of keep us reasonably on time. So maybe we can go to the last few questions that were not answered.
I don't have access to the questions. What are they?
So the question was, I think you may have touched on this. For listeners who are medical students now, when is the best time to do step 1? I was telling them MD5, but I can't remember whether we agreed that they
So I think the key thing is, don't do your exam when you just finish your basic science. As I said, the exam is very integrated, it's very clinical applied. You don't know the diagnosis, you won't know the answers. So the key thing is you kind of prepare as you're doing your medical schools, continue studying, and aim to do, when you are doing your UE 50 exam, you can do your step 1 exam. And then you do your internship and through the internship, you do your CK, you finish your internship, you are ready to apply. So towards the end, that's the best you'll get.
MD5 will be good.
Yeah, MD5 is good. You have doing the clinicals, you have integrated. And if you are studying, and remember, you are studying as you come along. I mean, as you study your usual, you enhance your USMLE material. So you are bringing a solid foundation of knowledge, and you can propel like that.
So basically what we're saying is MD1s, they have 5 years to basically study for step 1.
Yes.
Essentially, right? Yes. So you have 5 years to study for step 1. And then that way, if you have that solid foundation, really after internship, you should be good to study for step 2 and step 3. And that will probably be a very good, run. So if you're studying first aid, MD1 through 4, and then MD5, you're actually studying for the exam. That should, by the end of MD5, you should be actually in a very good position to kind of like do really well on step 1. Another question was, when should you apply in terms of like being out of medical school? Like, is there like a cutoff for like, since you graduate from medical school to applying for residency in the US? I don't know whether there was a 7 or 10 year embargo or what that answer is.
Let me answer this question this way. The best to apply is the earliest after you finish medical school. The longer it takes for you from medical school, the harder is it for you to match. And it's obvious. I mean, medicine is like an army. You come as an intern, you're like the foot soldier. So you are 50 years old, you're my foot soldier, and you're 24 years old, PGY2 resident. I mean, come on, you know, it brings some kind of friction, but also it's not really about if you are 70 years old and you finish MD, you graduate today, you are a fresh graduate. So it's not about your chronological age. It's about your age from when you graduated. And one thing I learned recently, as I started working with medical education, is when you do residence, you don't pay fees like East Africa and other countries because Medicare pays for your salary. And so Medicare reimbursement for residents decreases depending on the years after graduation. So when the program takes you as an older grad, they get a hit, they have to cover their salary and not from Medicare, and that makes it a challenge. So do yourself a favor, kind of stick to the timelines, try to apply as soon as possible, because that's the best way, like you have your high chances, and that's what you should try to do.
Awesome.
Full stop.
And I thought the USMLE number does not expire.
Forever.
Certification is like 7 years.
Yes.
Was it
USMLE number is for life. It doesn't expire.
What was the 7 years? The
document verification expires in 7 years.
The ESFMG.
Yeah, certification, the document verification.
All right, great. So that means if you were passed your USMLE exams, were able to get the ESFMG certification, you have 7 years to use it for applying for residency.
No, this is how it works. So you apply for ECFMG, you get USMLE number. USMLE number does not expire, does not change. Even if you change your name, you do whatsoever. So when you get your USMLE number, you open your account, you verify your documents. Your DNA attests that you are a doctor, you are a medical student. Mm-hmm. That verification lasts for 7 years. And that verification is the one which gives you authorization to apply for and do the exam in that 7 year span. Now, if within that 7 year span, you finish your exam, you get ECFMG certified, you are ECFMG certified for life. You don't repeat the exam again because you are done. And so what remains is you trying to apply to match. And so that's how it goes.
Awesome. I think we covered a lot of ground for our first USMLE 101 session. If there's somebody with a burning question they would like to answer live, they can raise their hand and maybe we can select a few questions as we're kind of wrapping up. But really the idea here is, as I said in the intro remarks, is one, decide whether or not you would like to train in the United States. If the answer is yes, then you definitely have to do the USMLE. Certainly, if you want to work in the United States, you definitely have to do this medical licensing exams, whether you've already done your MMed, whether you've done a Master of Science, whether you're a full professor, wherever you are. If you want to get a medical license exam in the United States, you must basically pass these medical licensing exams. That's why it's called USMLE. It's not just a random medical exam. It's a medical licensing exam. So therefore, it's going to give you permission to practice medicine, which is obviously a regulated profession here in the United States. So that's one part of it. Two, if you want to start the process, the first part is to get a USMLE number, which is free. So get your number, all right? When you get your number, there's the email that we have shared, and maybe Ignas, you can post the email again in the chat, USMLE@pursuit@gmail.com. Then we can now start to give you more information and then invite you to the next session, which will talk about tricks and tips for studying for the USMLE exam, step 1. And then once you pass that exam, we're going to put you into a different cohort, which will then basically start preparing for step 2, step 3, and therefore also get into the 301 session, which really starts to talk about application process. That's what we'll talk about, letters of recommendation. How do you get into like electives and observerships and all of that? But there is no point in us talking about electives and observerships. You don't even have a USMLE number. So it's kind of like, we can't really start like, getting far ahead of ourselves. And then lastly, if you do not want to like work in the United States, that's awesome. there's no problem with that. However, if you study with the first aid, you're going to be a better medical student and hopefully certainly a better medical doctor moving forward. And that is really the goal of all of these sessions, is to encourage us to elevate our standards of medical practice wherever we are. And you cannot elevate standards of medical practice without elevating our medical training. And so this is one way to kind of do that. Just by studying the step one and being in sync with other medical students across the world already elevates the degree of your medical education. I don't see any hands raised. I think maybe we have covered.
So I just saw a question flash, and I just want to provide a quick take. I mean, I understand the process can be, when you look in its totality, it's really like, it might think like it's unattainable, but it's chunk by chunk. It's spread over a certain time of time, a certain longevity of time. And Doctor, I've been in this game. I've been seeing people from real humble beginning, kind of going through the process. The more you show your commitment, you work, you do your exam, you scrap up your tuition from your salary from intern, you do your exam, you pass well, other people will be there to help you. But don't try to figure out everything before you start doing the basics. So put your foot, start doing, and hopefully things will open up, and that's what has been seen throughout. So don't worry about that. Somebody is asking about, there's recent election in the US, probably there's some immigration changes and everything. IMG makes a big chunk of residence training. As you do residence, you see patients. So it's beneficial, and that's why Medicare pays for it. I don't see the way somebody will just wake up and close it. So we have a big chunk. Like last year, I think almost 20,000 IMGs marched into residence programs. US graduate medical education has more than 180,000 people. Each year they march like 40,000 people. The senior from the US is just 19,000. So there's a need. Even if you're PGY 4, Trump is 4 years, amendment number 22, you can only do 2 terms of president. So just relax. You'll be fine. Don't try to kind of jitter yourself. Don't listen to people talking online. There's a lot of discouragement. Focus on your business and be ready. That's it. That's what you need to do.
Yeah, somebody was asking about electives are better than observership. Electives are better because basically, again, but many times you will only be able to do an elective, a student elective, when you're still a medical student, right? Because basically you can be taken as a medical. So once you graduate, we cannot admit you to basically take a medical student course. So that's why I'm saying when you're MD1 or MD2 and you have an opportunity financially and otherwise to travel abroad, then that could be a good opportunity for you to do that elective. Richard Chimba raised his hand. If you'd like to come online, you're welcome to ask your question. If you want to unmute Richard Chimba from Nashville, Tanzania.
Yes, thank you. Though my camera is not working.
No worries, no worries.
Yeah. So as I say, my name is Richard Chimba. Actually, I'm in Nashville right now, but generally I'm from Tanzania.
Yeah.
I graduated from University of Dodoma. I think I'm the first person to do step one from University of Dodoma. So I did step one like 2 months ago. I passed it. Now look for step two. Yeah. So why I want to talk just because I want to make a connection and network. So when I'm done with step two, so it'd be so easy for me to just to look for letter of recommendation, other thing in the network and advice.
Which year are you, Richard? Sorry.
I mean,
which medical school year?
Okay, I got it 2019.
Oh, you graduated 2019.
Yeah, 2019. Yeah, 2019, and
good. I would highly encourage you while you're in Nashville to look for observership opportunities. That will be good for you. Yeah, we should connect. I think maybe connect with Dr. Ignas. Hopefully, you've sent your information to the USMLE Pursuit at Gmail.
Yes, and I talked with Dr. Kola, I think. I talked with Dr. Kola, and even you get time to talk to me. Yeah.
We have a few colleagues in Tennessee who hopefully can arrange observership opportunities in that area. So again, I really want to thank all of our panelists and most importantly, Dr. Kola, for this amazing presentation. I will give Dr. Kola the last word as we close, but I just want to thank everybody for sharing their experiences, for sharing these 2 hours with our colleagues in East Africa. Again, we will share the recording later today on YouTube. There is also a similar recordings on online on YouTube. As you can look up Dr. Ignas Kola, USMLE 101, 201, 301. If you want to like look ahead and you want to kind of like peruse, again, we shared a lot of information. So we don't expect all of this to be very clear in the first go around. Sometimes you need to hear it multiple times. Please use this as a reference, right? So use this as a reference. And most importantly, act on the information. There's a lot of tips for you to do. So don't just sit here passively and kind of like watch other people. So, you know, buy the USMLE first aid textbook, register for the USMLE number, you know, get into like networks that are more like positive and connect with all of these PGY2s, soon to be PGY3s, and other people who have successfully navigated the process. Again, this is a small sampling of our colleagues who have successfully navigated the system. There are probably hundreds of African physicians in the US system, probably more than 1,000. In my hospital alone, I'm sure there's like 20 or 30 folks who actually went to medical schools on the continent. And that is just one US hospital. So again, it's very, very possible. And so you should seek those people so you can be encouraged. And again, work very hard, because again, at the end of the day, we want better medical doctors. If you're a good medical doctor, we can deploy you to work in other parts of the world, including here in the United States, in Tanzania, and so forth. So just don't really have a closed mindset. At this point, you should be growing to your best potential whatsoever. So basically, think about it as a soccer player. Like once you have that skill, you can trade it wherever you want to go. But if you don't have the skill, you have nothing to trade. So it's just the same way you look at the Premier League and people are kind of like playing for whatever teams. Medicine is very much similar. If you're really skilled, you can pretty much go whatever the hell you want to go. But the first point is to be skilled, and to only do that by studying hard and using strategies are well proven. Dr. Kola, you get the last 5 minutes and we shall close and adjourn the session. Karibu, Dr. Kola.
Oh, thank you very much. Thank you, everybody from the panel. I mean, sorry for the hiccup. I didn't, yeah. So the key thing is just make a decision. You know, you need to look at yourself, ask yourself multiple why questions. Why me? Why do I want to do this? Why? And then if you can convince yourself that this is what you want to do, then put your foot down and do it. Don't waste anybody's time. Don't try to deal. You cannot fluke to USMLE. You need to be the way they question. I'll talk more on the preparation. If you don't have the knowledge, it will show out. It will show out very clearly. So it's good that you prepare well. You don't waste anybody's resources. And it has been said, like, it's expensive, it's daunting, can I do this? But if you start doing and you show the will and you are doing well, things will converge. I mean, this is one thing which you don't have to see your path all the way. Just work at what you are working on, do your best where you are, and kind of connect. And as I said, as you see, like for Roland, he didn't even come to the US to rotate. I mean, he has those access to those attendings. He got the reference letters and everything else. And the exams are done there. So you can do all your exams and match and come to do your residence. So it's just trying to take the advantage of all the resources that you have to kind of put yourself in a prime position. And through this process, there'll be a lot of times where you have to apply yourself, whereby you have to troubleshoot. So don't come and ask trivial questions that you can Google. Google before you ask. You are thinking of something, Google it, try to refine your query, go to AI. There are so many answers online. When you come to one of us, you're asking, come with options. I look through, there is A, B, C, E. I'm thinking of B. What do you think? Then from experience, I think go with C because of A, B, C, D, E. That's how we should do. That's how, even like when you practice in the US, you go to see a patient, you don't come and present and say, now what do I do? You present a patient to me, you tell me how you are treating your patient, why are you treating, what test do you want to order, and then we talk about it and see what we do. So teach yourself to be that way. Be self-starter, be industrious, you know, don't give up, and good things will come up. And in real sense, doing this is not like trying to brain drain or to do anything, is to put you in an avenue where you can train with the best and be able to do even better. I'll just to touch, you know, a few years ago, there was no interventional radiology in Tanzania. Professor Frank started interventional radiology. They are training fellows from across East and Central Africa. These are people who will teach, will reach and touch more people than what you will be able to do in 3 lifetimes. So as you get this training and you are put in this platform, you can really help the other people. And that's what you should do. Always try to help person next to you. The pot is big. There's nobody is competing with you. There's an avenue for everybody. So be nice, play well, mentor people, bring them up and let them succeed. So that's what I will ask. Please share wisely, share kindly, and be a motivator for everybody, and let's move on.
You said it very well. I want to just replace brain drain with brain circulation. That's my new favorite phrase. It's called brain circulation, right? So you just circulate those brain power, and then you can basically do whatever. So long as you get good training, you can really deploy it. We're very passionate about the training space. We have training programs at MUHAS, interventional radiology, neuroradiology, and women's imaging. And we do have trainees from across East Africa, Uganda, Rwanda, and now the Congo. And again, there is no shortage. The only way to make better physician is to basically do training. And that's why the US invests a lot in training. And that's why they pay you to actually do training. That's why Medicare pays us to actually do the training. So it's like, it's an investment, because that's the only way we can generate a specialist. So again, thank you everybody so much. And we want to keep this session to about 2 hours, which is about the limit of attention span on YouTube. So until next time, we shall connect again. And again, thank you so much. And we shall adjourn our session now and give you back your lovely weekend. And thank you so much.
Thank you so much.
Asante.